Welcome back to Left and Right. My name is Michael A. Charbonneau. Today we're talking about obesity. To my right, Dr. Bernstein from the Dr. Bernstein Clinics, I should say. You've heard him, you've seen him, and you've seen his results. Then to my left, two people who are bringing some new products to our community, as they would say, Nutrigenomix. Beside me, Jennifer Ozsungur and her husband, Stefan Ozsungur. And this little unit right here is the actual unit itself, saliva-based. You deposit your sample in here, you flip this little puppy over, and then the chemical reaction, as I was saying in the break, it kind of looks like a roadside alcohol test. Very simple. Now, one of the things that I think people out there would say is, what kind of backup do you have with this? And I'm not trying to trap you here, but I want to ask, the 800-pound elephant that's in the room that says this is very, very new technology. There has been several articles written and some criticism as to the length of data sampling that was generated from this, and that it may be slightly premature. How would you, and that's not an accusation, that's a question. How would you talk about that? I mean, to say that you can take a piece like this to be able to evaluate saliva through a DNA test to identify things in your intake that can affect your weight loss or gain is quite revolutionary. How do you speak to those people who question the data and where you're coming from this?
Sure. There have been articles written in the past and presently actually that do criticize some genetic tests that are currently out there, mainly because they do look at a whole panel of different things that don't have substantial evidence behind them. And in addition to that, there isn't a healthcare practitioner that is reading the results and reviewing it with the client themselves. It's just a report sent to them. And unfortunately, because of that, there have been issues that have occurred in the past. And some of the tests that have been manufactured in the United States and in Europe have been banned in New York State and California.
They've been banned?
Yes.
That's a scary thing to say something's been banned. I mean...
The reason behind is that other important assessments, medical history, nutritional assessments are not done. The saliva sample sent in, results come back with recommendations for the general just the gene recommendations, and it may end up having dire consequences where if someone consumes something or is consuming more of something that they're not supposed to be consuming, they can get sick. So the whole point of this test is to combine the genetic test, the science of it, with a dietitian. It's only offered through registered dietitians.
You're not mailing in the results. They
Exactly.
come back to you.
Right.
So very sophisticated. I think it's 2.5 weeks or 2 weeks till the test results come back and allow you as practitioners to be able to interpret the results.
Exactly.
And then conduct a session with your client. The obvious next question is, what kind of a price point does this article, with your consultation and your professional appraisal of what the data is, just as a ballpark figure, what is something like this in your process cost?
The test generally is under $400,
right.
And for that fee, you're getting 2 separate appointments with the dietitian. So the first meeting is generally for the saliva collection, as well as we collect some contact information and that type of thing.
Right.
And then the second time we would meet is 2 to 4 weeks after, which is when the results would be sent back to us. And like I said, it's a 40-page report that comes back with all 7 dietary components and the results. And then we would spend 30 to 40 minutes going through each component and explaining the results.
So, Dr. Bernstein, we're looking at something that's under $400 here for an evaluation for someone to be able to have some type of a clinical, and I use the word clinical, evaluation.
Right.
Your process, you're dealing more with the morbidly obese, with those who need to accelerate their weight loss. What would be your price point? And I'm not, again, I know it's proprietary, but how would you describe to our viewers out there what would be a cost factor if they were to entertain your process?
Okay, first of all, we deal with anybody who wants to lose weight, 10 pounds to morbid obese, not just morbid.
Right.
We charge for the time that you're involved in our program. If you're seeing physicians and nurses, OHIP will cover our routine blood work and in most cases that we're doing. The cost of the diet program is $600 a month approximately, and you can expect to lose 16 to 20 pounds.
When you say the
for
diet
that.
program, is that the food?
No, that's the process. Patients are coming to our office 3 times a week. They're receiving vitamin injections 3 times a week. They're getting visits with nurses and physicians throughout that.
So you purchase your own food from a general grocery
Just
store?
regular
predicated
grocery,
on what your
regular
directions.
grocery food,
Right.
plus
Regular
grocery store food.
I love, and Dr. Bernstein's lettuce has arrived.
On top of it, though, when you're on a diet, you will save several $100s a month. So that's a big cost factor or cost saving. If you want to lose 30 pounds, it'll take about a month and a half. That'll run about $900 to $1,000.
Right.
If you want to lose 50 pounds, 3 months, $1,800. Some insurance companies will cover our costs. It's certainly medical practice, so it's a tax write-off as well. So it's not expensive at all.
Yeah, Jennifer, how would you take that? Do you think that someone who can lose 30 pounds in that amount of time can keep it off? Is this another gateway to do that, but not as radical? How would you?
Well, I mean, like you said, this is fairly new. It was launched last year, so before this, it was just general dietetic practice. We'd follow Canada's food guide and healthy Health Canada guidelines and sort of creating a sensible diet for people. I definitely believe that there's some truth to being on a low-calorie diet and losing a large amount of weight in a short period of time.
850 calories per day compared to 2,500 in normal. How would that affect your test? How would a Dr. Bernstein client who's in the process of going through his medically supervised process, do we know how that would affect the Nutrigenomix test?
It won't affect the test, and I'll explain this, is that all we're looking at in this test is DNA. So our DNA will never change regardless of what we eat, what vitamins we take, how much we exercise. Our DNA is the same from the minute we're born to the minute we die. That will never change. So you can do this test when you're 5, 10,
right.
20, 60. The results will always be the same, and there's nothing that you can do that will change these results. So like I was saying earlier, this is just one component that helps us sort of realize how we can prevent chronic conditions from occurring in the future. But the other part is creating, again, sensible guidelines and educating patients on how to eat a healthy lifestyle. So I wouldn't necessarily promote, a low-calorie diet along with the Nutrigenomix testing. It would be based on every individual person. Like I said, we do the full assessment where we actually understand where their body mass index is, if we need to adjust their body weight accordingly, calculate their energy requirements, and according to that, put them on a caloric diet that is sufficient for them. So like I was saying earlier, in today's society, people want a quick fix. They want to lose weight today, tomorrow. They want the magic pill. They want something that's going to melt their belly fat in a week. And we all know that that's not possible. It's unfortunate because people do want to see quick results, but research has shown that once diets are over or come to an end, 12 to 24 months after, people do rebound, gain their weight back, and then some.
That's what we're going to talk about. When we return, we're going to talk a little bit more about Nutrigenomix. We're going to also visit some more with Dr. Bernstein. But what I want to address in our final segment is the yo-yo portion. How many of you have gone on a diet? You've been so proud of yourself. You've lost your weight by whatever means, and then all of a sudden it all comes back and it's worse. What do we do about that? And what about childhood obesity? I'm Michael A. Charbon. We're talking about obesity. Our next segment coming up.